First News with Keeler in the morning on WIBX and WIBX950.com.
Here is Dr. Kent Hall from MVHS. Dr. Hall, of course, is the Chief Physician Executive. Doc, good morning.
Good morning. How you doing this morning?
Good. Thanks for coming on, and as always. And I want to start by telling you that one of us has had the vaccine, and he's doing pretty well. That would be Monaski, had the vaccine yesterday.
Oh, he did. Well, congratulations, Jeff. And you're feeling okay?
Well, so yeah, I mean, I'm here. I was very cold last night, freezing cold last night, and then woke up today, and I'm in here, and I'm cold again. Cold hands, cold feet. I feel chilly.
You seem to be having minor symptoms.
Minor. I'm a little sore. The arm's a little sore. I don't feel 100%, but yeah, it's not a big deal. I guess here's my question. Here's what concerns me. I'm surprised at how quickly, and we talked about a little bit about this yesterday. We've gone down the age brackets, and how quickly that I, one day after registering, was told, "Oh, you can come get it today." So I guess, why is it so easy to get the shot now? Is it because of an abundance of shots, or is it because of reluctance to get them?
So I think you've hit on two of the key factors there. Number one is we certainly have more vaccines available to us as all of the vaccine makers have been ramping up their production, and the supply chain from the makers to the federal government to the state government and then to the local areas has kind of solidified. So that certainly has played a part. I think the other, which is unfortunate, is that, there is still a significant part of the population, the numbers vary, but it's at least probably 30% of the population. In some instances, some people are quoting higher numbers, are skeptical of getting the vaccine right now. So I think it's those two things combined. And what I like is that in New York State, we have rapidly gone from, being fairly tight in terms of who we can give it to, and now we're basically starting next Tuesday. We're going to be opening it up to anybody over the age of 18.
Yeah. I think it's 16 starting next week. Is it?
Right. I'm sorry.
Yeah.
I misspoke. It was 16.
Yeah. So, and another example of that, primary urgent care, and they've got two locations. They're doing the shots in Utica on Tuesday. Maybe this was last week. Last week they came out and said, "Listen, we've got the shot. You can schedule an appointment." Yesterday they came out and said, "No appointment necessary. Just show up." And that to me says they've probably thought out some shots, and not enough people are signing up for it, so they need to use it before it expires. But which again is the same issue of we've got it, but not enough people want it.
Correct, and I'll tell you that we also received a fair number of shots within the Mohawk Valley Health System, and I would offer that if anybody who is listening wants to make an appointment to get a shot, they can go on our website and follow the link there for it.
Two things. I think the commercial is very helpful that the former presidents are doing. My God, Jimmy Carter looks old, doesn't he? If you've seen that commercial. It is true that President Trump is not in that commercial, which is unfortunate, but the remaining living presidents are, and I think that's very positive. The other thing is MVHS had a commercial that I saw for the first time yesterday, a TV commercial that is bilingual, and it focuses on some of the top demographics in the Utica area, and I think that was a really well-done commercial and very helpful to get that message out to the minority communities.
Yeah, we have been reaching out. In fact, I did a WebEx yesterday evening with some of the minority community leaders in the minority community to basically, see what we can do about reaching out to them. We need to, we and I'm talking about healthcare in general, we need to do a really good job of getting out there to communities that, honestly, we haven't done as good a job getting to before, because we need as many people vaccinated as possible to protect them. And this is what I told the people on the webinar. We needed to protect themselves. We needed to protect their loved ones, their friends and family. We needed to protect our community writ large.
So my daughter is diagnosed with asthma, and she is 18 years old. Tomorrow we both
newly diagnosed?
No,
okay.
She's had asthma. So tomorrow we have a scheduled appointment for the vaccine. She and I are both going to get the vaccine. Kind of a cool father-daughter type thing tomorrow. And I it's funny how I'm looking at that as it's a father-daughter moment. But I am. I think it's a big deal.
You know, it is a big deal, and congratulations to you and your daughter for doing it. And really, you know, that I think is emblematic of what we need to do in terms of really, you know, having this be, you know, family time and doing things together. We've spent the last year not doing things together, being separated, and actually doing things that are going to protect you and your daughter going forward, and, you know, your wife and everybody else that you come in contact with, you know, is really a very positive thing. I guess I'm surprised that your daughter hasn't gotten it before this, given the fact that she has asthma.
Only because she's been at school, so we really had to arrange this. And remember, she's had the virus. She had it with me, and so she was not eligible because it was too close within. So we're both just outside the 90-day period.
Oh, okay. Yeah, no, I had forgotten that she had it too. Yeah.
And interestingly, she has the very same, never had it before, has the very same shoulder and elbow pain that I have.
Yeah, well, you are linked genetically, so It is not surprising that you're going to have similar symptoms.
Yeah, interesting. All right, Andrew Derminio.
We have a couple listener questions. Okay. The first, Dr. Hall, when will the vaccine be FDA approved? My understanding is that it is, and that we wouldn't be able to be getting them, but this listener believes that it's not officially approved. Is that the case?
It is. It has been approved under what's called an EUA, an emergency use authorization. So that basically accelerates the process. They still have to do all of the testing and stuff. What they don't have to do, what they shorten up is the follow-up period. So normally vaccines to get full approval need to be followed for a year. And obviously we didn't follow this for a year. It was only followed for about 2 or 3 months. So I would say that we can look for full approvals from the FDA coming probably starting in the mid to late fall.
And if we are looking at a fourth wave that they keep talking about, getting the vaccine could be the difference in a person. Forget spreading it to somebody else. If you're worried that it's not approved by the FDA, I would think it's reward versus the cost of, versus the risk. I think the risk is that you could still get it and you could still wind up in the hospital. You could still die. The vaccine will decrease that chance of happening almost entirely.
That's correct. So all of the vaccines, even with the variants that we currently know about, decrease your possibility or probability of getting severely ill and or dying to essentially zero, which is very good. What they don't do is, with the variants, there is an increased likelihood that you could have some mild symptoms from it. So, we are seeing cases rising across the country, across the state. Thankfully, in Oneida County, we're still roughly in the same area. Maybe we've ticked up a little bit, but not a whole lot. The cases are rising basically for 3 reasons. Number one is the variants. Number two, honestly, is pandemic fatigue. People are just getting tired, and the third thing is we are opening up more. But they're not rising fast. And that's because of the vaccines, and it's also because while there is pandemic fatigue, people are still there are a large percentage of the population is still being attentive, which is fantastic.
Doc, we appreciate it. Thank you so much, and we will do it again tomorrow in the 8 o'clock hour.
Thank you, everybody. Please be safe, and be safe in this storm that's coming.
Snow is coming. It's winter again. All right, thank you. Dr. Kent Hall.
Prescription products require completion of an online medication consultation with an independent healthcare provider through the LifeMD platform and are only available if prescribed. Subscription required. Individual results may vary. Additional restrictions apply. Read all warnings before using GLP-1s. Side effects may include a risk of thyroid C-cell tumors. Do not use GLP-1s if you or your family have a history of thyroid cancer.
If you've struggled for years to lose weight and have given up hope, Did you know you can now access GLP-1 prescription medications at TryLifeMD.com? We're now offering eligible patients online access to GLP-1s, the breakthrough prescription medication that can help you lose body fat and weight. Listen to what people are saying.
It's fun to put on jeans that you couldn't get into 6 months ago.
Every morning, I look forward to getting on the scale.
For anybody who's struggling with their weight, it's a godsend.
And here's the best part. Your insurance may cover 100% of the cost of your medication. So go to TryLifeMD.com to have your eligibility checked right now. Get started today at TryLifeMD.com. That's TryLifeMD.com.